So Clara, come stand right next to me. So Clara, I've actually known since she was a little baby, and I was really fortunate. Actually, this is a really important couple of weeks for me personally. I've known Clara for a long time, and if it wasn't for her father, I probably wouldn't be back here in Seattle. I remember when I was a medical student, I actually rotated at the University of Washington, and her father was doing a pediatrics rotation at Children's Hospital. And I remember I met him then, I think it was 1999. So long, I think, before Luba and Greg met. And then I stayed in touch with him. And then he was an MD PhD student. I did lots of research and was very interested. Greg was one of these amazing surgeons that he was very talented. He was a scientist. He was a great surgeon. He was awesome with patients. And he really wanted to, he knew exactly, like he was a concert pianist. He had so many different things that he did. And I stayed in touch with him. And then when I did my residency at the University of Virginia, he helped me, we always kept in contact. And then I remember when he started dating Luba, I think she was a medical student. And so it was kind of like, it was, I had never seen Greg like so excited that he was like, I met the perfect woman. And then when he finished residency, he was one of the first surgeons that came here and actually helped recruit me. If it wasn't for Greg, I probably would have never been in Seattle. And then, we became close friends, and, he really helped me kind of define my practice and really helped me get back into Seattle because I was gone for 15 years. And at that point, him and Luba were married, and Clara was born. Sadly, Greg passed away from pancreatic cancer, and just after he turned 50 years old. And so it's been 10 years, and watching Clara and Ben grow up to be these amazing children and to see the legacy that he's left behind is really incredible. And so we've had the opportunity, this 2 weeks Clara is spending with me, and it's really been, it's a dream for me, and I know, Greg's looking down from heaven, to me, it's one of these things where every time I look at Clara, I'm like, I see a little bit of Greg and Luba, and just these little mannerisms, just even in the OR. And I asked her last week if she could do a presentation. So she's a junior at Bush School, and she's doing an internship with me and the team here. So she's going to talk about the history of, we were talking about, electrocautery, coagulation, all these things in the OR. So I thought, what a better topic for her to talk about electrocautery in the operating room. So Clara, thanks so much for coming. Sorry for that long introduction.
Okay, so thanks for that amazing introduction. Here's my presentation on the history of electrocautery and the Bovie. I'm going to start by going over sort of a very quick overview of how surgical tools have developed, and then I'm going to dive a little bit deeper into heat and cautery during surgery and the development of electricity in surgery, and then I'm going to talk about diathermy and the Bovie. Okay, so the beginnings of surgery. Humans began by using teeth and nails for small procedures like cutting the umbilical cord, and then started developing primitive knives from sharp leaves, sticks, bamboo, or stones. And the first knife was created during the Mesolithic period, which was around 8,000 BCE. And the Greek physician Hippocrates was the first to coin a surgical knife in around 400 BCE. Okay, one example of early surgery is trephination. It was a form of ancient neurosurgery and just removing bone from the skull. And signs of trephination are found in Neolithic skulls. I have two examples here. One is unhealed and one is healed. These are both Neolithic skulls. The Neolithic period was from 7,000 to 1,700 BCE. I include this because it was an example of early surgery to sort of think about the tools that they were having right then. And then we go into the Dark Ages and the Golden Age of Islam. So the Dark Ages were from the 5th to 14th century, and the Islamic Golden Age was from the 8th to 14th century. And the progress of medicine in Europe was halted by the Dark Ages, but the Golden Age of Islam brought advancements in healthcare. The contributions were most prominent from the 10th to 13th centuries, but many surgical instruments were developed, the scalpel was perfected, and cautery through heat and acids was also perfected at this time. The inventors from this age influenced future revolutions in medicine. And then the production of surgical instruments only continued to grow everywhere, but American companies were slow to grow the production of these surgical tools until after the American Civil War, where producing high-quality surgical tools became more profitable and therefore popular. Okay, now I'm going to get into specifically electrocautery and the Bovie. So early cautery, the use of cautery actually dates back to the prehistoric period where stones were used to stop blood flow, and the use of heat to control bleeding gained popularity in the 6th century BCE. The use of heat and acids to reduce bleeding during surgery was perfected during the 10th to 13th centuries Islamic Golden Era, like I mentioned before. And then electrocautery, the use of electricity, 18th century brought the discoveries needed to include electricity in cautery. In the 19th century, those tools were actually developed. A man named Morton in 1881 showed that a current of 100 kilohertz could pass through the body without pain, and similar results were then found 10 years later at 10 kilohertz. And it was also discovered that when the current passed through, it influenced body temperature, oxygen levels, and carbon dioxide elimination. And then electrical currents were used to treat circulatory problems in the late 1890s. Okay, in the early 1900s, a physician named Joseph Riviere discovered that when he touched a metal electrode, the spark from that electrode coagulated his skin without burning him. He then used an electrical current to treat an ulcer on a patient's hand, and soon after, diathermy became crucial in treating lesions on the skin and for the coagulation of tumors and hemorrhoids. In 1910, William Clark took this diathermy unit and increased the amperage and decreased the voltage, which made deep tissue penetration possible. He introduced desiccation because he noticed that the effect from the spark dried out the skin, and he became the first American to use electric surgical tools to remove malignant tumors on skin. And now here's the Bovie, William T. Bovie Jr. and Dr. Harvey Cushing. So Bovie developed William Clark's diathermy unit, and he used different currents for cutting and coagulation instead of the same one. And he increased the current on the unit and added like a surgical loop, which was used for cutting and coagulating. And at the same time, Dr. Harvey Cushing, the father of American neurosurgery, saw a diathermy unit cutting beef, and he had the idea to further develop it for surgery. He contacted Bovie and he tested his electrocautery device for the first time in 1961. Together, they created the omnipresent electrocautery device known today as the Bovie. And this was one of like the foundations for how scientists and physicians work together to develop tools. Yeah, here's the Bovie development. Here's like a really old Bovie machine and a new one. And then it's used for like so many different surgeries across so many fields. And it's amazing to me how this one scientist and physician could develop something like this. Cool. Thank you.
I did not know that yet again neurosurgeons changed the history there.
Yeah.
Cool.
So I have a present that I've been holding on to at my house for 10 years.
Oh. Okay.
So one of the important things for neurosurgeons are your tools. So electrocautery is one of them, but probably the most cherished tool that a surgeon can have is your loops. So this is your father's loops. He actually gave them to me and he said, Rod, one of my kids is gonna go into medicine and hopefully both, but whoever does, make sure they go into neurosurgery. Okay. So I've had this for 10 years. It's actually survived a fire, a flood, two floods in my house, and a little fire as well. So here's the loops, and it's amazing. So Greg had this quote in here, which is really cool, and I think, when you guys know what the loop boxes look like, but he had this little quote in here, so whenever he opened his loops, I think he looked at it. So basically it says, forces beyond your control can take away everything you possess except one thing, your freedom to choose how you respond to the situation. And he was a big fan of Viktor Frankl. And so I've kept this, Clara, and there's no one that's more deserving than you to have this. And so here's your dad's loops. And then this is his lead. I don't really think he cared about his lead as much, but he always made fun of me and spine surgeons. But nonetheless, here's his lead, and I know he would be so proud of you. And I know you're going to be a great physician, and hopefully you're going to be a neurosurgeon. And I don't think he was particularly fond of spine surgery. So I think you're going to have to do, we're going to have to reset higher standards for you, and you're going to become a brain tumor surgeon. So great job, Clara. Yeah. Awesome.
Thank you so much.
Yeah. Fantastic presentation. All right. Who's next?